In the pursuit of better sexual performance and confidence, one name has become increasingly common in conversations among men of all ages: Tadalafil. You've probably heard of it, perhaps from a friend, seen it mentioned online, or even considered it yourself. Its promise of enhancing sexual encounters has made it one of the most widely used medications in the world. The idea of taking a simple pill to ensure a reliable and strong erection has transformed the way many men approach intimacy, turning what was once a source of anxiety into an area of newfound confidence. But with this widespread popularity comes a critical question that often gets overlooked in the rush for a quick solution. Do you truly understand what you're taking? Beyond the immediate, desired effect, what are the long-term implications of using this medication, especially on a continuous basis? The ease of access and the normalization of its use can sometimes mask a more complex reality. Are there hidden risks that accumulate over time? What happens to your body when it becomes accustomed to this external help? This isn't about fear-mongering. It's about empowerment through knowledge. In this video, we are going to pull back the curtain on Tadalafil. We'll conduct a thorough deep dive, exploring exactly what this substance is, how it works on a biological level, and what its intended benefits are, some of which might surprise you. More importantly, we will confront the potential risks, separate fact from fiction regarding myths about dependency and tolerance, and discuss what continuous use really means for your health. Stay with me until the end, because understanding the full picture is the first and most crucial step toward making truly informed and safe decisions about your sexual health and well-being. So, what exactly is Tadalafil? At its core, it belongs to a class of drugs known as PDE5 inhibitors. That might sound technical, but the way it works is actually quite logical. To understand what Tadalafil does, we first need to understand the basic mechanics of an erection. When a man is sexually aroused, the brain sends signals down through the nervous system to the penis. These nerve signals trigger the release of a chemical called nitric oxide in the erectile tissues. This nitric oxide then stimulates the production of another substance, a messenger molecule called cyclic guanosine monophosphate, or cGMP for short. Think of cGMP as the key that unlocks the door to an erection. Its primary job is to relax the smooth muscle cells in the walls of the blood vessels within the penis. When these muscles relax, the arteries widen, allowing a much greater volume of blood to rush into the two chambers of erectile tissue, the corpora cavernosa. This rapid inflow of blood is what causes the penis to become firm and erect. It's a beautifully coordinated hydraulic system, initiated by your brain and executed by these chemical messengers. However, the body also has a natural off switch to ensure an erection doesn't last forever. This switch is an enzyme called phosphodiesterase type 5, or PDE5. The sole purpose of PDE5 is to seek out and break down cGMP. As PDE5 does its job, the levels of cGMP decrease, causing the smooth muscles in the blood vessels to contract again. The arteries narrow, blood flow out of the penis increases, and the erection subsides. In men with erectile dysfunction, this PDE5 enzyme can sometimes be overactive, or the initial production of cGMP might not be robust enough, meaning the off switch is flipped too quickly, preventing a full or lasting erection. This is precisely where Tadalafil comes in. Tadalafil works by selectively inhibiting or blocking the action of the PDE5 enzyme. It essentially puts a temporary roadblock in front of that off switch. By preventing PDE5 from breaking down cGMP, it allows cGMP to accumulate and remain active in the erectile tissues for a longer period. With more cGMP available, the blood vessels stay relaxed and open, which makes it significantly easier to both achieve an erection upon stimulation and, crucially, to maintain it for the duration of sexual activity. Now, let's address a critical misunderstanding about this medication. Tadalafil is not an aphrodisiac or a magic on button. It will not cause you to have a spontaneous erection out of nowhere. The entire chemical cascade we just discussed begins with sexual arousal, the initial signal from the brain that releases nitric oxide. Without that initial stimulus, there is no increase in cGMP, and Tadalafil has nothing to work with. Think of it this way. If sexual arousal is the spark that starts the fire, Tadalafil is not the spark itself, but rather something that helps the kindling catch fire more easily and burn for longer once the spark is there. This is a crucial distinction. The medication facilitates a natural process. It does not create one artificially. This is why it's called a selective inhibitor. It's designed to target the PDE5 enzyme that is most prevalent in the penile tissues, allowing for a localized effect, though, as we will see later. Its influence isn't entirely limited to just that one area. While the benefits of tadalafil are clear, its story doesn't end with improved erections and urinary flow. The ability to relax smooth muscle tissue has led to its approval for treating other medical conditions, completely unrelated to sexual performance. One of the most significant of these is benign prostatic hyperplasia, or BPH, a common condition in aging men where the prostate gland enlarges and causes bothersome urinary symptoms. The same mechanism that widens blood vessels in the penis also works on the smooth muscles located in the prostate and the neck of the bladder. By relaxing these muscles, tadalafil can alleviate symptoms like a weak urine stream, difficulty starting urination, and a frequent or urgent need to go. This makes it a unique dual-action treatment for men who may be experiencing both ED and BPH symptoms, which often occur together. It is also prescribed in specific, higher-dose formulations to treat pulmonary arterial hypertension, a serious condition where there is high blood pressure in the arteries that supply the lungs. Here again, its vasodilating properties are put to use to reduce the pressure and ease the strain on the heart. Perhaps the most distinguishing feature that sets tadalafil apart from other PDE5 inhibitors is its remarkably long duration of action. While other popular medications in its class typically last for about 4 to 6 hours, a single dose of tadalafil can remain effective for up to 36 hours. This extended window of opportunity earned it the nickname the weekend pill when it was first introduced. For many users, this is its greatest advantage. It offers a level of freedom and spontaneity that is highly valued, as it removes the immediate pressure of having to time the pill's intake shortly before anticipated sexual activity. This long-lasting effect allows for a more natural and less clinical approach to intimacy over a couple of days. Finally, we cannot overlook the significant psychological benefits that come with effective treatment for ED. Erectile dysfunction is more than just a physical issue. It can take a heavy toll on a man's self-esteem, confidence, and overall mental health. The constant worry about performance can create a vicious cycle of anxiety, where the fear of failure itself becomes a primary cause of the problem. By providing a reliable physical response, tadalafil can help break this cycle. The assurance that an erection will be achievable when desired can dramatically reduce performance anxiety, restore self-confidence, and thereby improve the quality of intimate relationships. For many, this psychological relief is reported as one of the most life-changing aspects of the treatment, allowing them to reconnect with their partners without the shadow of doubt hanging over them. Now that we've covered the benefits, it's essential to have an equally clear-eyed look at the other side of the coin, the risks, side effects, and the pervasive myths that surround tadalafil. Like any effective medication, it doesn't come without potential downsides. The most common side effects are generally mild and are a direct result of the same vasodilation mechanism that helps with an erection. Because the medication doesn't just affect the blood vessels in the penis, it can also relax vessels elsewhere in the body. This can lead to a headache, as blood vessels in the head expand. It can cause facial flushing, giving the face a reddish, warm appearance. Nasal congestion is also common, as the blood vessels in the nasal passages swell. Some men report experiencing acid reflux or heartburn, as the smooth muscle in the lower esophagus can relax, while others may feel muscle aches, particularly in the back and legs. For most users, these effects are temporary, often lasting only a few hours, and tend to diminish as their body gets used to the medication. However, there is one major risk that is not mild and must be taken with absolute seriousness: the interaction with a class of drugs called nitrates. Nitrates are medications often prescribed for heart conditions like angina, a type of chest pain. They work by dramatically widening blood vessels to increase blood flow to the heart. Tadalafil, as we know, also widens blood vessels. When these two substances are combined, their effects are amplified, leading to a synergistic and potentially catastrophic drop in blood pressure. This severe hypotension can cause dizziness, fainting, and, in the worst-case scenario, can be life-threatening by starving the brain and heart of adequate blood flow. This is a non-negotiable contraindication. Anyone taking nitrates in any form, pills, patches, or sprays, should never use Tadalafil or any other PDE5 inhibitor. This is the single most important safety warning associated with this class of drugs. Beyond these direct physical effects, we must address the more nuanced psychological risks, particularly the myths surrounding dependency and tolerance. Let's start with dependency. When people hear this word, they often think of chemical addiction, where the body develops a physical need for a substance and experiences withdrawal symptoms without it. It's crucial to understand that Tadalafil is not an addictive substance in this chemical sense. It doesn't interact with the brain's reward pathways in the same way that opioids or nicotine do. Your body will not go into physical withdrawal if you stop taking it. The real danger lies in psychological dependence. This is a far more subtle, but equally powerful phenomenon. It often begins with men who may not have a severe clinical case of erectile dysfunction, but are struggling with performance anxiety. They try Tadalafil and, unsurprisingly, it works wonderfully. The erection is firm, reliable, and the anxiety vanishes. The experience is so positive that it creates a powerful mental association. I performed well because I took the pill. Over time, this thought pattern can become entrenched. The man's confidence no longer resides in himself, but in the medication. He starts to believe that he is incapable of performing without it, even if his underlying physical ability is perfectly adequate. He becomes afraid to even try having sex without his crutch. This is psychological dependence. It's not that his body needs the drug, but his mind believes it does. This can create a cycle that is difficult to break and can ultimately undermine natural sexual function and confidence in the long run. Another common concern is tolerance. This is the idea that, over time, your body will get used to the medication and you'll need to take higher and higher doses to achieve the same effect. Fortunately, with Tadalafil, this is largely a myth. The body does not typically build a tolerance to its mechanism of action. So, if you find that a dose that once worked well for you is no longer as effective, it is highly unlikely that you've become immune to the drug. The far more probable cause is that the underlying condition causing the erectile dysfunction has progressed. Erectile dysfunction is often an early indicator of broader cardiovascular issues, such as atherosclerosis, hardening of the arteries, diabetes, or worsening nerve function. If these conditions are not being managed, they will continue to impact blood flow and nerve signaling, making it harder to achieve an erection. In this scenario, the medication seems less effective not because it has stopped working, but because the physical problem it's trying to overcome has become more severe. This is a critical signal that it's time to address the root cause of the health issue, rather than simply increasing the dosage of the symptom-treating medication. Finally, let's quickly touch on a couple of other myths. You may have heard alarming stories linking these drugs to blindness or infertility. While there have been extremely rare reports of a condition called NAION, a sudden loss of vision in one eye, a direct causal link to Tadalafil has not been definitively established, and the risk is considered incredibly low, primarily affecting men with pre-existing risk factors. As for fertility, studies have consistently shown that Tadalafil does not negatively affect sperm count, motility, or morphology. In fact, by facilitating intercourse, it can indirectly help with conception for couples facing ED-related challenges. In essence, the primary risks of Tadalafil are not the sensationalized myths, but the very real danger of its interaction with nitrates and the subtle, but insidious trap of psychological dependence born from misuse. After hearing about these potential side effects and risks, you might be wondering if there are other ways to address erection issues, perhaps by targeting the root causes naturally, without relying on pharmaceuticals. Recently, the personal story of a man who discovered a bizarrely simple, all-natural purple hardening tonic has been gaining a lot of attention. He claims it completely restored his rock-hard, long-lasting erections by targeting what he calls the boner killer enzyme in the body. If you're curious to hear his full story and learn about this powerful natural home remedy, You can watch the full, free video presentation right now. Just open your phone's camera and point it at the QR code you see on your screen. The link will pop right up. I've also placed a direct link for you in the pinned comment at the very top of the comment section. Now, for those who are set on the pharmaceutical route, understanding the correct application is crucial. Understanding the correct way to use Tadalafil is just as important as knowing how it works. The medication comes in different dosages, and each is intended for a different approach to managing erectile dysfunction, so let's break down the two main strategies. The most common dosages you'll find available are 5 mg mg and 20 mg mg, and they serve very different purposes. The lower dose, 5 mg, is designed for daily use. This regimen involves taking one pill every day at roughly the same time, regardless of when you plan to have sexual activity. The philosophy behind this approach is to maintain a steady, consistent level of the medication in your bloodstream. Because Tadalafil has such a long half-life, a daily dose ensures that its therapeutic effect is always present. This has a significant advantage. It restores a sense of spontaneity. You don't have to plan your intimate moments around a pill. The readiness is always there, allowing for a more natural and less premeditated sex life, which many men and their partners find liberating. Over several days of consistent use, this daily dosing leads to a stacking effect, where the residual amount from the previous day's dose combines with the new one. This accumulation brings the effective concentration in the body to a level that is consistently sufficient for most men with mild to moderate ED, often equating to the effectiveness of a higher, on-demand dose. On the other hand, the higher dose, typically 20 mg, is intended for on-demand use. This is the approach for men who have sex less frequently or who prefer not to take a pill every day. With this method, you take the pill a specific amount of time before you anticipate having sex. However, one of the most common mistakes users make is with timing. Tadalafil is not instantaneous. After you take it, the medication needs time to be absorbed into your bloodstream and reach its peak concentration. While some effects can be felt as early as an hour after ingestion, the optimal window of effectiveness is usually between 2 to 3 hours after taking the pill. Taking it just 30 minutes before you hope to be active is a frequent error that leads to disappointment and the mistaken belief that the medication didn't work. For the on-demand dose to be effective, a little bit of planning is necessary to allow the medication to reach its full potential. It's also worth noting that while these are the standard dosages, the right amount can vary from person to person. Some men may find that a lower on-demand dose is sufficient, while others might need adjustments based on their specific health profile and the severity of their ED. This is why a one-size-fits-all approach is not ideal and underscores the importance of a personalized strategy. So, to bring everything together, Tadalafil is undoubtedly a powerful and effective tool in managing erectile dysfunction and other conditions. It works by facilitating a natural physiological process, offering benefits that extend from the physical to the psychological, with a unique long-lasting effect that many find advantageous. However, its effectiveness comes with a responsibility. The most significant risks are not the sensationalized myths, but the very real and dangerous interaction with nitrate medications and the subtle, yet damaging, potential for psychological dependence that arises from improper use. The greatest danger is not necessarily the drug itself, but the way it is used. Using it without a clear need, without understanding the correct timing, or without addressing the root causes of erectile dysfunction can create more problems than it solves. Thank you for joining me for this in-depth look at Tadalafil. I hope this information has provided you with a clearer and more balanced understanding. If you've had experiences with this topic you're comfortable sharing, or if you have questions, please leave them in the comments below. Your insights could help others in this community. If you found this video valuable, please consider subscribing for more content dedicated to demystifying health topics. Remember, when it comes to your health, knowledge is not just power, it's the foundation of your safety and well-being.